Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. An honor to meet you in this beautiful day. Thank you for coming to this presentation. I would like to share about research paper. Let us introduce ourselves. My name is Fitri Fauzia. Next to me are Janatun Makwa and Nazia Marta. We are here on behalf of our team Nuphaniljas, Dusiani Nurmalasari, and Sabrina Amalia. In this opportunity, I would like to present our research paper entitled Providing Health Service Innovation to Reduce Mortality Risk. Then, we will explain why health service innovation, namely ambulance, is so important for us. Finally, you will know how to access this platform. Public service in Indonesia are experiencing a crisis of public trust. This symptom begins to appear with the lower public trust at the center or at the local level. The implementation of public service carried out by government officials in various service sectors, especially those concerning the fulfillment of civil rights and basic needs of the community, has not performed as expected. There are many complaints for the public, such as convoluted service procedure and work mechanism, lack of information, lack of consistency, and limited service facilities and infrastructure. Likewise, the development of the health sector in Indonesia is currently not growing optimally. The government has not provided the quality of health service evenly. In fact, the main key for people to carry out activities is a healthy body condition. Healthy condition require many things including access to health service. Likewise, the development of the health sector in Indonesia is currently not growing optimally. The government has not provided the quality of health service evenly. In fact, the main key for people to carry out activities is healthy body condition. Healthy condition require many things including access to health service. The purpose of health service in the achievement of public health degrees that satisfy expectation or consumer satisfaction. Drug excellent service by service providers that satisfy expectation or provider satisfaction and institutional service institutional. The interaction of the three main pillars of harmonious and balanced health service is a combination of the satisfaction of three. Harmonious and balanced health service is a combination of the satisfaction of three parties. The integration is an effort that can be done is to increase the response time to condition of the community who need help in an emergency situation. The important thing in pre-hospital emergency service is known as the golden time. The success of an emergency response depends on the time it takes to arrive to the location where a person is lying sick or where an accident has occurred. The faster the response, the better the result. It is reasonable to say that all efforts should be made to reduce the time factor in alarm chains for calling to picking up the call, to sending, to getting ready, to drive to the location on the survivor. Based on observation, patients who can survive an emergency situation or patients who arrive at hospital and receive follow-up care in a short time have a greater chance of survival than patients who arrive late at the hospital.
The effectiveness of response time depends on three components, namely call processing time, time spent by the ambulance turn to prepare and travel time to the scene. Response time can be longer due to poor communication, untrained research and traffic jam on major city roads. Processing time and poor communication in responding to call are still experiencing problem, namely that absence of integrated communication from the ambulance team to health facilities. Resource skills are also felt to still need to be improved. The reason is that there is an assumption that when a person already has a poor prognosis, health workers immediately judge that the patient will not last long. In fact, it is this assumption that makes health workers lazy to provide service. And this assumption actually becomes a belief that health workers are able or unable to treat patients with bad condition. Ambulance workers also need attention. Nowadays, more and more ambulances that do not belong to hospital or do not belong to health facility, namely non-governmental ambulances, are traveling around the street. It is an open secret that the officers who are in the ambulance sometimes do not know the action that be taken when traveling to help the patient who is being cared. Please note that ambulance should have a special lane when traveling, or at least when the road users' ambulance sirens are heard, giving the ambulance enough road access to get through the road without any obstacle. The density of the population makes the road more congested, so that the ambulance journey becomes hampered, which can cause the patient to die on the way or death on arrival. In this effort, the security force, which in this case are responsible for the police, should be able to provide ambulance access to health facilities. However, it is very unfortunate that the police usually only conduct the crime scene and do not open roads or traffic access. In addition to heavy traffic, the fast condition of Indonesia can create problems that can be underestimated. The fast Indonesia has areas that are still lagging behind, or so-called remote areas. These remote areas have access to travel and facility that are still lacking, so that the journey to the hospital in remote areas can be constrained due to inadequate road access. Ambulances that cross roads in remote areas also require a special fleet to arrive to health facilities. After arriving at the health facility, the patient can be treated immediately and the family will take care of hospital and administration and ambulance financing. Ambulance financing in Indonesia is still a concern. Most people prefer private cars to take sick patients. This is because the ambulance financing, which is more expensive than private car, has not been covered by the Social Security Administering Agency. This agency contribution given every month still does not cover the cost of the ambulance. If this can be done, it is possible that the ambulance transportation price can be generalized so that the price is the same. If the agency has penetrated into ambulance financing, the transportation of patients from or to the hospital can be slightly resolved.
Research conducted by the Pew Research Center concluded that of all adults in Indonesia, 42% have a smartphone, 28% have a regular cell phone, and 28% do not use a cell phone. From these figures, we get two conclusions. First, the number of smartphones users in Indonesia is very high, but those who do not use a smartphone are probably because they do not have access to a smartphone and its accessories. Second, Most of those who do not use smartphones are rural people who live in remote areas of the country. So, even if they have a smartphone, they cannot use it optimally because regional constraints in remote areas are less accessible to public service such as the internet. Efforts to overcome the above problems have established provider 118 emergency ambulance service as a pre-hospital emergency service which were formed in efforts to overcome the above problems have established provider 118 emergency ambulance service as a pre-hospital emergency service which was formed in 1990. Currently, services regarding pre-hospital emergency conditions are known as the Integrated Emergency Service System. This effort is supported by the existence of a Public Service Center or 990. These efforts are still not maximally implemented in Indonesia. It is proven by many people who are not familiar with the service as an effort to support public service, namely the Ambuline program, and integrate online ambulance. Ambuline is an application that can be used by every citizen who has Ambuline is an application that can be used by every citizen who has a smartphone. This application will integrate patients with ambulance to health facility providers such as hospital, health centers, and clinics. This program is based on the increasing number of smartphone users and the increasing number of ambulance in Indonesia. Ambuline as integrated online ambulance is an innovative work in the form of smartphone-based applications by utilizing information and communication technology. This innovation integrates patients with ambulance in providers of healthcare facilities, hospitals, health centers, and clinics, and the police. Ambuline is inspired by online motorcycle taxi applications such as Gojek, Grab, and so forth. This program is based in the increasing number of smartphones and the increasing number of ambulances in Indonesia. The purpose of this program is to increase the time of rapid response to the conditions of the community who need help in emergencies. In addition, in order to achieve the degree of public health that satisfies consumer satisfaction through excellent service by health service providers, this ambuline can be replicated by all health facility providers in Indonesia, the police, and all Indonesian people who can easily buy download through Play Store and App Store on Android and iOS phones. Thank you very much your great attention, ladies and thank you very much for your great attention, ladies and gentlemen. Thank you for listening. May all those we have shared be beneficial for all of us. Wassalamualaikum warahmatullahi wabarakatuh.